Deputy Speaker, the real value of health politics is when, as a famous playwright once put it, the nation's long sickness of health and living begins to mend. President Zuma mentioned in his government's plan to mend our long sickness of health with the National Health Insurance Scheme, which is an elaborate, overcomplicated, convoluted, and monumentally costly path to universal health care. Constitutionally and morally, there is no question that we must have universal health care. But, Deputy Speaker, why go to all this trouble and expense when all we need to do is fix what we've got? The NHI is nothing more than a Rolls-Royce that does not, in fact, address our basic health problems. Let's look at the issue of maternal mortality. The Medical Research Council confirms that about 1,500 pregnant mothers and mothers-to-be die every year. Limpopo has the highest maternal death rate, and the Western Cape has the lowest maternal death rate. Hear this Eastern Cape story, and I quote, "My uncle advised me, a young pregnant mom living with HIV told the Human Rights Watch, to call an ambulance when labor started, but I did not want to go to hospital. I was scared of how I would be treated," she said. "I hear nurses are very rude and they are rough." Even if she called the ambulances arrived too late or not at all. Tameka, a young East London woman very ill with TB, told the South African Human Rights Commission that when she asked the brother to call an ambulance, he was advised that it was, and I quote, "unlikely to arrive." They told us they did not come for bedridden patients. Our total ambulance fleet, colleagues, is 2,690, both public and private, but only half of them are in working order. Do we need the NHI to fix this problem? No, we don't. What we need is the following: an easy-to-remember emergency number like 911 called from any device. A national critical fund to underwrite all parts of the health system offering emergency services. The fund would ensure that all residents face equal access to the nearest treating facility, regardless of whether they are on medical aid or not. We need to have a national and provincial emergency services war rooms that track performance of ambulance response times. Honourable members, you know a public hospital is well run the minute you enter the premises. It is clean, it is visibly well organized, and it has no long lines of patients waiting for assistance. Most of our public hospitals are not well run and are terrible places in part in which to work. The African Health Placement had one doctor speak for many when he said that, and I quote, "Very poor management is one of the reasons I left. The management does its own thing and they do not care for doctors or patients." Do we need the NHI to fix this? No, we don't. The secret to good management is to appoint clinically qualified CEOs, to borrow from the private hospital systems and have robust protection against outside interference, political and commercial. Honourable members, medical waste removal is a critical back hospital function. In surprise visits to 5 hospitals, I found at Kimberley Hospital, West End Hospitals in the Northern Cape, and Sabi in Mpumalanga to be in very good shape. But 7 were breaking the strict regulations that govern medical waste segregation, storage, removal, and disposal. At Livingston, Port Elizabeth Provincial, and Uitenhage District Hospitals, the infrastructure was so inadequate that I laid a charge with SAPS against the MEC for Health, Dr. Pumza Dianti, for violating the Occupational Health and Safety Act and the regulations issued under the National Health Act. At Rahima Musa Mother and Child Hospital in Johannesburg, boxes of infectious and needle stick waste were illegally stacked in an unsecured area to which children had access. The medical waste removal company Bushley had failed to collect the waste. Bushley's name also appeared on improperly stored waste at Mpumalanga's Rob Ferreira Hospital. Bushley has now been awarded, can you believe it, a contract recently for the Free State. Notorious for tender corruption and financial mismanagement, I have requested the Auditor General to launch an investigation into the sector. Do we need the NHI to fix this? No, we don't. Good and accountable management will do the job. The DA offers a much simpler route to universal health care that makes no additional fiscal demands. Let's drop the means test. Let's create a health subsidy for every citizen and legal resident. Let's keep the provinces as delivery agents, but allow them to buy from both the public sector and the private sector. Use the NHI conditional grant of R1 billion a year to underwrite the building and staffing of clinics nationwide. The Department of Health and the National Treasury has already agreed that the grant should be used to support the ideal clinic rollout, and we concur. I thank you very much.